Pre-diabetic or type 2 diabetic? Which is which? Well, the term pre-diabetic really bugs me the first time I heard it because I am absolutely involved in caring for type 2 diabetic. But then I heard people saying I am pre-diabetic, or some says I was pre-diabetic, which sounds like champ. Well, then what's the difference? What is the difference between pre-diabetic and diabetic patients or, people? Look, diagnosing a type 2 diabetes includes a thorough clinical assessment by your healthcare provider, considering your medical history, your family history of diabetes, risk factors, and they are going to ask about if you ever have signs and symptoms like increased thirst and urination, cravings, fatigue, and unexplained weight loss. And in addition to that, they are going to ask you to get a blood test like fasting blood sugar, HbA1c, and OGTT, or oral glucose tolerance tests. If your results are on the criteria of type 2 diabetes, they might going to look for further investigation why your sugar is spiking. And sometimes they will take your blood test again, the same blood test for some other time, for at least 2 takings to confirm that you are diabetic. So I got this from American Diabetes Association and Standards of Medical Care in Diabetes 2021. So type 2 diabetes typically diagnosed based on the criteria of number 1, the fasting blood sugar. Usually their blood sugar level is 100. Their fasting blood sugar level is 126 and above. For borderline, pre-diabetic people, it's between 100 milligram per deciliter and 125 milligrams per deciliter. And for the oral glucose test of diabetics, OGTT. So in this test, the healthcare professionals require you to fast overnight, and then they're going to, take your blood sugar level on the following day. You'll be asked to consume a solution containing a glucose, and then they're going to take your blood glucose level 2 hours after your intake of that solution with glucose. So for diabetic patients, it's the blood glucose, the OGTT result would be 200 milligrams per deciliter and above. And for pre-diabetic, it's between it's borderline again. It's between 140 and 199 milligrams per deciliter. Lastly, the hemoglobin A1c. So for diabetic patients, it's usually 6.5% and above. And for pre-diabetic patients, it's between 5.7 and 6.4. That range. So giving you a room for improvement. So this diagnostic criteria may vary slightly among different organizations and guidelines, but the references provided, that's being said here is based on American Diabetes Association. So this is just your daily sugar reminder. Mind yourself and have a lovely, amazing day.